Welcome back to our real webinar. Thank you for joining me. My name is Claire Crisp. I'm the Executive Director for Wake Up Narcolepsy. Now, it gives me great pleasure to introduce our next speaker, who is Dr. Jason Ong. He is the Behavioral Sleep Medicine Director at Knox Health and an Associate Professor in the Department of Neurology and the Center for Circadian and Sleep Medicine at the Northwestern University Feinberg School of Medicine. Dr. Ong received his PhD in clinical psychology from Virginia Commonwealth University and completed a fellowship in behavioral sleep medicine at Stanford University. Dr. Ong's primary research interest is developing and testing non-pharmacological approaches for treating sleep disorders and improving sleep health. These programs include the mindfulness meditation, cognitive behavioral therapy, CBT, for insomnia, hypersomnia, and other chronic health conditions such as migraine, headaches, and sleep apnea. His research has been supported by the National Institute of Health, the American Academy of Sleep Medicine, and other organizations, not-for-profit organizations. I should add that Dr. Ong is one of our Wake Up Narcolepsy sponsored researchers also. He is a licensed clinical psychologist and a diplomate of health behavioral sleep medicine, delivering CBT for insomnia and psychosocial support for patients with hypersomnia. Thank you, Dr. Ong, for joining us.
All right, thank you very much for the introduction, Claire. I think next time I'll have to give you guys a shorter intro to read because it's taking up too much time, but thank you very much and welcome everyone. One of the challenges with doing these remote presentations is you get to see where I am and what's going on in my background. So once I turn on my video, I realize how cluttered this room is. So I have my virtual background on. Let me share my screen here, and that way you guys can hopefully see the presentation. Okay. Is it showing up on your end with the slides, everyone? I don't know if someone can.
Yes, it is. Yes.
Okay, great. Thanks for the confirmation there. Okay, so yeah, it's a real pleasure and an honor to be here today to be able to present to everyone here. I wish I could do this in person and see you guys, but with the way things are now, hopefully this will still be very informational and educational for you. So I'm going to talk about some trends in narcolepsy and mental health. I'm going to touch on some things that are in the pipeline and hopefully are actually getting out in the clinics and so forth in terms of telehealth, maybe some digital versions of mental health treatments. And also I was asked to talk a little bit about the impact of COVID. So hope to talk about some things related to more recent events here. So this idea of health-related quality of life has gotten more attention, especially in people with narcolepsy. So what we're referring to here is basically not just the disease itself, but the impact that this disease has on your life. As you can see here in these points, that pharmacological treatments that are actually pretty effective at reducing narcolepsy symptoms. But the issue is that the quality of life still remains poor. So there still is a very strong impact that these symptoms have, and also just the challenges of managing narcolepsy and the things that come with it. And one of the particular areas that people have honed in on is sleep. So just to show you a couple of studies here that, and actually this has come out in several studies where people with narcolepsy have between 2 to 4 times the rate of psychiatric comorbidities, meaning things like mood disorders, depression, for example, anxiety disorders, like phobias, social phobia is one that I think comes up a lot. And that this is at a higher rate than what you see in control groups or oftentimes as people who are matched with age and gender. So this is a lot more than what you would expect in the general population. And another important aspect here is the stigma from narcolepsy. This is usually a very negative portrayal of having the condition, whether it's from the media, the public, a misunderstanding, and that seems to be associated with depression and poor functioning as well. So on this slide, what I'm showing you is just an example of one of the studies here. This particular one took a large data set And what I'll just bring your attention to is at the bottom, you can see there's a bunch of different, very common psychiatric and psychological conditions: depression, bipolar disorder, anxiety disorder, generalized anxiety disorder. And if you'll just see the rates here, so you have the controls and the narcolepsy, and you can see just looking at the percentages, you don't even have to know a lot about how to do fancy statistics, but you can just see that in across almost all of these conditions, that the rate and the percentages of narcolepsy are about 2 to 3 times that of the control condition. So for example, in depression, we have 48% in a narcolepsy group, 25.9% in a control group. And that's, you see that pattern pretty much goes down here, down the line here with a lot of these other ones. Any anxiety disorder at the very bottom here, it's 51% versus 22% for controls. So just to highlight how much more prevalent these conditions are in people with narcolepsy. So some of you may have seen this. This actually comes from a website that's www.knowNarcolepsy.com. But this, I think, also kind of highlights some of the struggles that people with narcolepsy have. I think most of you out there that have narcolepsy or are family members of people with narcolepsy are very familiar with this. But 86%, so, a very, very high percentage of people reported that narcolepsy is a life-changing disease. 4 in 5 say that living with narcolepsy is a daily struggle. I'll just kind of jump around here. So 37% reported having failed a class at school or withdrawal from a class. So, you can just see from these numbers just the impact that narcolepsy is having on people's lives. And the only other thing here is that nearly all people surveyed agreed there's more to be done. So 40% said that they don't normally discuss with their healthcare professionals how narcolepsy affects their daily lives. A lot of times when you go to the doctor, you only have a small amount of time. You can't quite get into everything. You're focusing on just medications or what you need for medical treatments. You don't quite have time to talk about how this is affecting your life. So that seems to be one major gap. And then this other one I'll point out here, 94% felt that new treatment options are needed. And similarly, 94% felt that more education is needed. And I think in this case, it's education to a lot of different groups, the general public, even healthcare professionals. And I'll come back and talk a little bit more about that later on as well. But the point here is that, this really has a tremendous effect on people's daily lives, and that there really is more that we can do. So, in the context of mental health, I want to just spend some time talking about what works, what doesn't, and what's special or particular about people with narcolepsy in terms of mental health treatments. So first of all, in terms of what are our options for current mental health treatments, again, you guys probably know this, there's basically sort of the pill or PayPal question, right? So we have the pharmacotherapy, so you can get the happy pill, which I try to kind of highlight here with this picture. Or you can go and talk to a therapist here, in this case, our furry friends here. But just, I always like this picture to kind of depict, what psychotherapy traditionally is kind of thought of. But, the bottom line is these are our two main treatment options for mental health. And they can both be effective, and the effectiveness does vary a little bit in terms of different conditions, whether it be depression, anxiety, or so forth. So, this question of like, well, we have these treatments available. What's the deal? Are they not being used by people with narcolepsy, or is there something in particular about people with narcolepsy that they're not responding as well to, the mental health treatments, or is there something else about that? And so this led us to embark on this study, which is what we call a mixed method study. And what I mean here is that, you used to thinking about research studies as being objective, it's quantifying data, we have numbers, right? And so we run our fancy statistics, and that helps us understand whether or not something works, or whether or not there's some kind of cause and effect. When we're talking about mixed methods, we bring in some qualitative data. Now, this is usually interviews. These are like the things that people tell us. These are things that are basically beyond the numbers that are still really important. And I think in a case like this, when we're trying to understand, well, what's missing? And the question we really wanted to try to answer here is, how does narcolepsy impact health-related quality of life? And along with that, what are some issues in terms of receiving treatments, especially mental health treatments, that people aren't getting or isn't connecting well. So this gets a little bit deeper into the how. So what I'm going to show you is not numbers really, but really more quotes. Okay. So first of all, the quality of the symptoms that affect health-related quality of life, it's not just that people are sleepy, it's the fact they are constantly sleepy. So this constancy, that quality is really what's impactful here. This quote, people have the perception that if you have narcolepsy, you just feel fine and then you randomly fall asleep. They don't understand that it's a constant thing. Okay, so I think that kind of highlights this idea here that the quality of the sleepiness is really very impactful. And you guys probably know about cataplexy, and it's not just having the cataplexy, but it's the unpredictability of when you might have cataplexy. So this quote here from somebody, basically what made me go downhill was with my cataplexy, I was walking on campus and there was this long spot on campus that there isn't really anything to hold on to. And I had an incident in which I went all the way down to the ground. Even to this day, I still avoid that area, and it's really taken a lot out of me. So, in this case, avoidance of that really created a lot of anxiety and change, even just this person's, access to certain parts of campus. So, again, it's the quality of, the fact that this cataplexy occurs unpredictably that really had a strong impact. So I talked about stigma earlier. This is to elaborate more on that point, along with this idea of self-perception. So in general, narcolepsy is poorly understood by the public. Again, we talked about the lack of education. There's a lot of negative social stigma. Oftentimes, in movies and television shows, people with narcolepsy are portrayed as being lazy. They might be the funny character that people laugh at. In other cases, people are even skeptical it's a real condition. So, this makes it very challenging for people to understand that it's hard to even get past this stigma. This quote here, I feel like people think of it as kind of a joke, and they're like, oh, that sounds great. I wish I slept all the time. And of course, this is very insensitive. This is not something that's controllable. And as we talked about earlier, it's a constant thing. So this is in no way desirable. The negative effect on self-esteem and self-efficacy. So self-esteem is really more how you feel about yourself, and self-efficacy is really your perception of your ability to be able to do something or make a difference. Okay, so sometimes those two terms are used interchangeably, but they do mean some different things. What we found here is that some people with narcolepsy were hesitant to tell other people about their diagnosis. There's negative stigma, people don't understand it. So in other cases, they didn't want to tell their employers, so they try to hide it. And people talked about this idea that it seemed like an invisible illness. And in fact, some people were even ashamed of having narcolepsy. And there was oftentimes this feeling of being less capable, especially when they try to compare themselves where they were before they started having symptoms and getting diagnosed, that there was this real change in the self-efficacy component of it. So a couple of quotes here. I get tired trying to explain why I am tired. Okay. I think that's quite succinct in explaining how they feel. I tend to focus on who I want to be, but I need to focus on who I am. Okay, so there's this sort of longing of, something that they're not quite, they're not grounded in the present moment in terms of, who they are and where they are now. So, that's kind of where people are at. Then we wanted to probe a little bit deeper into what are your current challenges with treatments? What are you getting? What are you not getting? And the idea here was so that we could start to brainstorm how to address these gaps, especially in the case of mental health interventions here. So most people did talk about meeting with their sleep doctors or going to a sleep clinic about every 3 to 6 months. So that's good because it means that they're generally on top of their medications, getting evaluations to see if there need to be any other changes in their medical care for narcolepsy. But what people also said is that there wasn't sufficient time to discuss psychosocial aspects. And we also saw that come out in that other slide that I showed you. And this is a quote that's very common. My sleep doctor listens to me, but does not provide advice on psychosocial aspects. So that seems to be one gap. People also talked about a very strong dissatisfaction with mental health providers. Most felt that their mental health provider did not understand narcolepsy. And because they didn't seem to be on the same page, it reduced rapport. So that's like the bond that you have with your therapist, and it made it harder to trust that therapist. They don't totally understand you or what you're going through. They don't understand narcolepsy. It's really hard to have that connection that, in a lot of psychotherapy contexts is really important for being able to make progress. This person said, I get so frustrated because I spent an hour in therapy explaining what narcolepsy is. Okay. So they're having to do the education during their session when really they're paying their therapist to try to help them, right? That doesn't seem to be fair. And that there are a lot of challenges with accessibility, that the symptoms of narcolepsy create challenges with appointment attendance. This one quote, I've lost doctors because I could never make it. I wouldn't wake up if I have nobody to call, I'll turn alarms off. So, whether it's just, not being able to make it due to sleepiness. In other cases, people talked about how there wasn't a sleep provider or an expert in narcolepsy close to where they lived, especially if they lived in a more rural area. So there are these challenges with accessibility that also seems to be an issue. So in terms of what's trending, what are some newer psychological therapies? So, with the information that we got from that mixed method study, we started to develop what we call cognitive behavioral therapy for hypersomnia, or CBTH. And we did this using telehealth. So in this particular study, it's what we call a feasibility study. So much like when you're developing a drug, at the beginning, you don't just go with a dose and start giving it to people. You try to figure out okay, what's the appropriate dose? Is it safe? These type of things. So that's really what this study was about. It's kind of if you build it, will they come? And, what's sort of the best parameters to be able to deliver this type of intervention, if it even should be considered as a possible intervention. So I'm not going to go through this in detail, but I just wanted to give you some ideas that this was a program that we had different modules, realizing that people with narcolepsy, not everyone's the same. Some have cataplexy, some don't. Some have some more issues with nighttime sleep and so forth. So we wanted to have this set up where clinicians could select what modules were most appropriate for the particular patient, so it was more flexible. Okay. The other thing is that this was not just for narcolepsy, but we wanted to try to see if people with idiopathic hypersomnia could also benefit from this. That's why we call it CBT for hypersomnia, not just narcolepsy. But a big part of what we focus on is trying to provide more structure and giving tools for people to manage their daytime functioning, and doing things like splitting up the day into smaller chunks, if possible, trying to plan naps rather than just going until you run out of energy, which is what most people do. Also talking about the nighttime part, making sure that you're setting aside regular time for sleep at night, because that's important in terms of helping to reduce any excessive sleepiness that might, exacerbate some of the narcolepsy symptoms. We also spent a lot of time on other things like emotion regulation strategies, how to engage in social support, and when possible and if applicable, we also talked about some other things like accommodations for work, school, depending on if the person's a student or is working, how do they handle some of those things. So we try to make this kind of a multi-module intervention. This particular study was designed in 6 sessions. So just wanted to give you an idea of some of the things that we were working on. And as I mentioned, this is delivered through telehealth. And the reason we went down this road, and I should say this was actually done before COVID. So we kind of lucked out that we already started going down this pathway. And COVID has really kind of, made telehealth, brought that out into the spotlight a little bit more. But, we wanted to respond to some of the things that we heard about access. We wanted to provide greater opportunity for people to be able to engage in this. And so we started off, thinking that we didn't want to just recruit people locally here. I live in Chicago, but we wanted to expand this out to people across the country. We just had it in the U.S. For this one, but theoretically, there's no reason to limit it, to just the U.S. That's one of the nice things about doing things online. And this one, we had a individual version, which you see kind of on the right, what that's supposed to represent. And we also had a group version of this program because we also weren't quite sure what would be best. We thought that, having a social component might be helpful for people, but the individual might also be more conducive for sharing more and engaging in more one-to-one work. I'll just show you just a little bit of data here. And to make this easier, there's a lot of words on here, but you'll see the one thing that sticks out here is this bar that has GSE. And just to kind of help you understand this, what we mean by Cohen's D is basically what's the effect or what's the impact from the beginning of treatment to the end of treatment that something has. And this is called the PROMIS scale. So there's different scales here with depression, anxiety, but the one that really stands out is this GSE. And this GSE, if you look down here, is actually general self-efficacy. So this is actually really important and really in my mind, really valuable data that we got, that this program really does seem to enhance that self-efficacy that people in our other study really talked about as being a problem, in terms of not feeling as capable and so forth. So I was really glad to see that it seemed that this particular program, at least this preliminary study, does seem to have an impact on that self-efficacy that we think is really going to help people in terms of their psychosocial functioning. So the other thing I wanted to talk about here is mindfulness. And a lot of my research has actually been to bring mindfulness, meditation, mindfulness practices into the sleep disorder and sleep health domain. And I think, in today's age, people probably know about mindfulness. When I first started doing research in this, I sometimes had to define it. But if you're not familiar with this concept, it's really pretty simple. It's just grounding yourself in the present moment, much like what this person is right here. And a lot of times when you're just able to bring your attention and your awareness to what's happening right now, just whatever's in front of you, and just trying to watch each moment unfold, it prevents sort of the rumination that takes us into the past, like did I do something right? Did I do something wrong? A lot of times that leads to depression. And it also avoids a lot of the what ifs, of like, well, what if I do this? What if I do that? That it tends to brew more anxiety of what happens in the future. So there can be a lot of calming and really in many ways stress reduction that can happen when you just bring yourself to the present moment. It's very difficult. Okay? It's a simple concept, but very difficult to do in practice. And that's part of the reason why mindfulness requires a lot of practice. And the idea is that that practice is done. Okay. So right now there's a lot of these apps and programs, and it seems that new ones are coming out. I would say probably the two most common ones that people have heard of are Calm and Headspace. I think those are probably the two biggest mindfulness programs now. And I think what they've done a good job of doing is they made it more digestible. You don't have to be a Buddhist monk, or you don't have to go on a meditation 1 or 2 months to be able to really practice mindfulness. But you can practice it with these smaller chunks of meditations, shorter meditations. And I think that's what these programs have done a good job. They made it more accessible to people. And I'll highlight key elements of mindfulness. So awareness, again, this idea of mindfulness is cultivating awareness of what's happening in front of you in this moment. Whether or not you're sleepy, whether or not you are fatigued, whether or not you are alert or awake, these are important states. Sometimes we're just so caught up in what we're doing that we're doing it without full awareness. And then in the case of people with narcolepsy, sometimes you just run yourself, you sort of run the batteries dead, so to speak. What I was saying earlier, that sometimes it's helpful to take planned naps so that you're not getting to the point where you're so exhausted you can't do anything. And probably, for a time before you get to that, you really aren't very aware or fully engaged with what you're doing. So having some awareness might allow you to manage your energy a little bit better and really, not run yourself so, get yourself so exhausted as frequently. So, we think awareness can help people manage energy a little bit better. Non-attachment. This is probably a little bit more applicable for people with insomnia. That's the other sleep disorder I work with. But in that case, people are very attached to a certain need for sleep. They try to force it, and that's part of what seems to cause the problem of insomnia. And what I think is also very important here for people with narcolepsy is self-compassion. And this is basically treating yourself kindly. And I think a lot of times we forget to do that. A lot of us are givers. We try to take care of other people, but we sometimes forget to take care of ourselves. And we do still need to do that. And I showed this earlier, but one of the things that I started thinking about more is, can self-compassion help with some of these issues with self-esteem, self-efficacy, and even stigma? So we actually have a study. This is actually an ongoing study that we call ASCENT, stands for Awareness and Self-Compassion Enhancing Narcolepsy Treatment. And the idea is that these are people who are receiving current treatments. So, in most cases, it's medications that are prescribed by their sleep doctors. This is what we call an adjunctive treatment, meaning it's a treatment on top of what you're already getting from the medical side that we think can help people in terms of psychosocial aspects. And in this one, we're doing it through mindfulness meditation. So, it's sort of this crazy idea that I had where, usually people think of meditation as being, oh, this is calming, this is quieting, this is, really a treatment for insomnia. But we think that some of these same principles and practices can really be useful for people with narcolepsy in terms of, dealing with the psychosocial aspects and managing quality of life. So this is another one of those feasibility trials. In this one, we're actually testing different versions of the mindfulness program because we're not quite sure what's most suitable for people with narcolepsy. We have kind of a 4-week version, which is more of the compressed one. The standard 8-week, most of these mindfulness programs are done in 8 weeks. And then there's also a 12-week version that we have that's sort of what we call our extended version. And so this is actually, as I mentioned, it's an ongoing study. So if you're interested, this is information. You can also reach out to me, or I can provide this to Claire or other folks at Wake Up Narcolepsy. I think they still have some of this information on the website, but if not, we can certainly get it to you guys if you're interested in participating. And the nice thing is this one's also done through telehealth, so it's open to anybody in the US. We will be recruiting, I think, probably through the end of the year. So another opportunity if people are interested in doing some research that really won't interfere with their current treatments for narcolepsy. So just the last part, I want to talk a little bit about COVID-19. And there are a few studies that have been published on this. Now, most of these are just questionnaires, but I think they do pull out some interesting things in terms of what people with narcolepsy are going through with the quarantine and the pandemic. So this particular study was done in Brazil. By the way, the studies I'm going to show you, they're all done internationally. To my knowledge, there hasn't actually been studies published here in the US on narcolepsy. So in this study, what's interesting is that they found that, as people are not going into work, that what's happening is that their bedtimes are getting a little bit later, and their wake up times in particular are getting later. And that, in addition to this drift later, that they're also more irregular. People don't have like fixed bedtimes and wake up times that we typically do when, schools and work, we're in the office and so forth. And a lot of that's because we don't have to commute. And also, we have a little more flexibility in when we start the day. So that's been a change. In this study, I think they actually found an increase in sleepiness. In another study, they actually found some same things about changes in the scheduling. This one also talked about more frequent napping. This was a study that I believe was done in Italy. And I think in this one, they actually found a reduction in the daytime sleepiness. They did find a little bit of an increase in body mass index. So, maybe appetites were a little bit higher. And then this is a smaller study done in China on the management of narcolepsy. And what, they had some similar findings in terms of bedtime and wake up time, but they also kind of raised the point that I think is interesting, that it's also created an opportunity for us to do more behavioral management of narcolepsy symptoms because, we don't have the same confinement with work schedules and commuting that in our pre-pandemic world we had. So maybe this is an opportunity to really highlight some of the behavioral changes that can be made, as people's schedules are a little more flexible. So just to highlight some of these things, some of the factors here that with the stay at home, there is a reduction in physical activity and light exposure. So that can change our circadian rhythms. There's a lack of social interactions. Also, there's a reduction in access to medical care. I think one of the studies earlier talked about this. So some people weren't going in to get their medications. I think one study did report a reduction in stimulant use among people with narcolepsy. So, that's an unfortunate part of it, as people are staying at home. The other thing is that there's this constant bombardment of negative news. One of the most powerful behavioral schedules in psychology is what's called an intermittent reinforcement schedule. This is the type of schedule that's associated with gambling and so forth, where you don't know where you're going to hit the jackpot and you keep doing that behavior. So in this case, there's this constant bombardment of negative news. It makes us, it's basically a schedule that, will produce a lot of anxiety. Okay. And, other things like long-term impact of COVID, and I think there's findings that the depression might be more persistent for people who've been infected with COVID-19. And a lot of this, in my mind, it's almost as if someone is conducting this evil experiment on humans where they throw everything at us that we know is very challenging, for our mental and physical health. That they're keeping us locked up. We, have very limited access to other people. It's been really tough. So, it's just been a very challenging time with mental health. But what I do want to end on is some tips that I think, even though it's been tough, I think there's still some things that we can do during this time. And I've tried to highlight these here. So regulate your rhythms the best that you can. Try to have regular times set aside for sleep, daytime activities. If you can, get outside, try to do some physical activities. Also regulating diet, light exposure. I think those are all things, that even if you don't need to be rigid, but I think, just regulating them is going to be important, making sure you do engage in these things. And along the lines of engagement is enjoy, plan fun activities. This is part of taking care of yourself. I would say this is part of being, compassionate to yourself. Take the time to have fun still. It's easy to forget to do that. The rest part, I have you learn to take planned naps. I think that planned naps for many people with narcolepsy can be very helpful. Of course, there's considerations of responsibilities, and even at home, if you have a dependent, you obviously, have to be mindful of that. But there could be some opportunities to bring in some planned naps, even though some people think that it's not quite possible. In some of our previous studies, we've been able to get creative in terms of helping people figure out where they might be able to take some planned naps. Monitor your mood. So, sometimes we're not the best judge of our own mood. So check in with a family member or a friend, hey, does it seem like I'm behaving differently? Things like that can be quite helpful. And if it does seem like your mood is changing, try to contact your doctor or a professional, especially if it is more severe, serious. So you're not just kind of relying on your own self-will and willpower to regulate things. Connect, stay connected with healthcare. We talked about opportunities with telehealth and digital health. Don't forget to go to your doctors, stay on top of your healthcare. And the last one, I took this admittedly from a colleague in my new position, where she called it the Fauci ouchie. So I think that stay safe and if appropriate, get vaccinated when you're eligible. I think this will, be good for, not just individually, but also for our community as a whole in terms of trying to get over this pandemic and getting things back to hopefully, at least close to where they were. So the last thing here is just to end on this. I think that, when I was fortunate enough to get my vaccine, and I just remember when I walked in to get it, that there was a sense of hope. And, it felt like, there's a sense of excitement. And it really, I hadn't felt that in a long time. And I do think that there's hope. And not just for COVID. I think just in general with narcolepsy, there's a lot more drug development going on. I've been in sleep medicine for almost 20 years. And, there seems to be more activity on narcolepsy than I remember, at any other point in my career. So I think it can be an exciting time for narcolepsy. And, hopefully we're not too far away from finding a cure or some effective treatment. So, this is a quote from one of my favorite movies, Shawshank Redemption, where, Andy Dufresne, who's the main character, is writing to Red, who's played by Morgan Freeman. Remember, Red, hope is a good thing, maybe the best of things, and no good thing ever dies. So, hopefully, with this hope, we can keep it alive, and we're hopefully moving on to a better time. So thank you very much for your time. And I think we hopefully have some time for some questions here.
Thank you so much. That is really encouraging to end on such a hopeful note. And I couldn't agree more that these are very exciting times as a community, and thank you so much for your research and your contribution to improving the lives of people with narcolepsy through mindfulness and those other methods that you mentioned, such as CBT. Now, we do have some questions, so I'm going to just ask you them from the list. The first one is something I can relate to in my family. How do others deal with not being able to meditate because all you do is fall asleep? I rely on more active meditative styles, but do you have any other thoughts?
Yeah, great question. And that's one of the things that, in our study, as we were trying to design it, that one on mindfulness, we talked about, so, in that one, we do have some quiet meditations, but we really try to bring in more movement meditation. So, it brings up the point that meditation doesn't always have to be this quiet activity, what people think of where you're sitting, like cross-legged, or laying down and just sort of like focusing. You can do meditation, especially mindfulness meditation, walking. There's things like Tai Chi that also has a lot of mindfulness in it. You can even do it in things like, when I go running, sometimes I bring in some mindfulness. So you can bring it into physical activities that, might end up being more conducive for people with hypersomnia, with narcolepsy, where you're struggling, in a quiet meditation where you might be more prone to falling asleep. So yeah, I think adapt it to whatever seems to work for you. Yeah.
That's really helpful. Thank you. Is it just as useful to try to have a deep rest if you can't fall asleep because of meds, but still experience excessive daytime sleepiness?
So I guess useful in terms of managing symptoms or, yeah, I mean, I think that to the extent that you can, having, like I would say getting good regular sleep at night. And if you can, having some planned naps is, a good way to go. I guess if the question's getting at like, are they reasonable substitutes or, if there's some benefits beyond that, like with other symptoms, it's a good question. I don't know if we necessarily have that data yet. Hopefully as we do more research, we can try to answer that. I don't know if it'll extend to other symptoms, but at least maybe with sleepiness, it could help, at least minimize that.
Okay, thank you. A question from Tammy Anderson. What would you recommend as far as tools or resources to use in a preventative way for mental health for teenagers with narcolepsy?
Preventive way.
Yeah, I suppose to sort of, we're anticipating this complex presentation of a teenager with being a teenager and then a teenager with narcolepsy. I think this is a parent asking, are there steps that could be taken to, perhaps anticipate, prevent what might be depression and with social anxiety withdrawal and so on?
Yeah, prevention is always challenging. I think in some, I guess it depends on sort of like the context. I guess maybe one thought off the top of my head would be like bringing in the social components. I think especially with teenagers, it's really challenging. They, in many ways, they look to their peers before they look to family members or certainly adults. So, I know like Wake Up Narcolepsy has, good programs and there's other, other like, I know Narcolepsy Network and Hypersomnia Foundation also have some programs. I think earlier I saw that there's a camp that you guys have. So that might be a starting point, just so that I think, it might help the teenager not feel like they're alone, and that there's other people. And maybe that can at least start the dialogue. I think the main thing is to have them communicate, as much as possible, because it's challenging. So I think things that can help promote communication and some kind of social connection can be useful, and as best we can in terms of preventing mental health issues.
We do actually have a teenage support group starting in June. And that's,
okay.
So for the teenage years, and we're going to hopefully do breakout groups for sort of the younger teens, slightly older teens. So hopefully, Tammy, your daughter can join us for that. You did mention quite a lot in the beginning of your presentation, Dr. Ong, this term self-efficacy. I wonder if you could explain that with a view to its relationship with narcolepsy.
Yeah, so the term really refers to like your perception of your ability to achieve something, accomplish something, do something. And so, one of the things we heard a lot about in our study is that people felt that they were less capable. And a lot of people were judging it based on, well, here's what I used to be able to do, and then here's what I can do now. So just kind of thinking about like people where like, for example, if they were a student, I used to be able to get A's, I used to be able to, it wasn't a problem doing my homework assignment. And now it's a real struggle to maintain my attention, things like that. So that's a change of self-efficacy. They don't see themselves as being able to accomplish or do the same things. And a lot of it's just because they, the symptoms of narcolepsy, especially sleepiness, but other things, the cataplexy could be a factor and so forth. So there's that change in your perception of what you can do. In other areas, there are psychologists and people who do behavioral medicine have been able to help people increase that self-efficacy. For example, managing diets, managing blood pressure. And so, it's really getting them to understand that, it's a challenge, but there are some things that you can do to improve your own ability to do things. So, some of that's educational, some of that's usually behavioral, and some could be cognitive, getting people to kind of shift their mindsets a little bit. So, hopefully that can provide a little more context for this idea of self-efficacy. And, in terms of how we think we can help people with narcolepsy, this is a work in progress. If I could answer that question well right now, I think we'd be able to help, a lot more people. But, I think that, part of it is giving them like in more interpersonal context, giving people some tools to be able to tell other people, and sort of also helping them manage, if they get a negative response, how to deal with that. So giving them, kind of better equipping them to handle different situations is kind of like one step in that direction. And I think with some of the emotion regulation skills, like with mindfulness and so forth, that's kind of the other way that, just because if you aren't able to do exactly the same things you were able to do before, it doesn't necessarily mean that, you're not a good person or, you're worthless. It's easy to kind of get wrapped into that type of thinking, but that maybe, there's a different set of parameters that you're working with now. So, there's some other tools that can be helpful in that area.
Thank you. I think we've got time for one more, and this might be because you touched on COVID-19 and its impacts on people with narcolepsy, but we have a question that asks, have there been any reports of patients being diagnosed with narcolepsy post-COVID-19 infection? I'm not sure whether you've seen more cases or if you can comment on that.
Yeah, that's a tough one for me to comment on. I mean, the short answer is that I haven't heard of that, but I'm also not necessarily in the know. It's probably a little bit more of a medical question. I mean, I think in the sleep community, I don't know of it being like a high, I don't really even have heard much talk of it, but I think someone like Dr. Mignot would probably, really know, and, things like that would probably come to him more. So yeah, I wish I could answer that question, but I just really don't really have the knowledge or the access to be able to answer that well. Yeah.
It's probably too early as well. I mean, maybe there'll be some data in the next few years, but thank you so much, Dr. Ong, for joining us. It's always a pleasure to have some time with you. This has been very, very helpful. As I say, these are recorded, these presentations, so we can access your content again through our YouTube channel. So thank you so much.
Great. Yeah, thank you for inviting me. Yeah.
Of course. Yeah, thank you. Have a good rest of your day.